Pain is actually pretty uncommon in kids and teenagers with scoliosis, but it's actually very common in adults with scoliosis. Now, the reason for this is what drives scoliosis or idiopathic scoliosis in growing populations is completely different or the opposite of what drives scoliosis in older populations or people that are skeletal mature. Hi, I'm Dr. Chris Gubbels, leading authority in the non-surgical treatment of scoliosis, and there is often a misconception or misunderstanding about the relationship between pain and scoliosis. In fact, it's actually pretty common where parents that have kids with scoliosis may not think the curve or the scoliosis is really a big concern because their child may not have a lot of pain. But pain is pretty uncommon in adolescents with scoliosis. And when you get teenagers or children with scoliosis and pain, it's usually a low-grade ache, kind of a dull ache. They may say it's, maybe a 2, 3, 4 on a scale of 1 to 10, but it's not generally something that's very severe. And it's pretty uncommon for kids or teenagers to have scoliosis and not have any pain at all. And what's also interesting, or what's important to understand, is the severity of the scoliosis has no correlation with pain levels in growing populations. This is really important because you don't want someone to think that treatment's not needed just because their child's not in pain. I mean, there's many times when I talk to parents and I ask them what their biggest concern about their child's or teenager's scoliosis is, and they'll say pain, or they may comment that they don't really think it's a concern or maybe didn't think it was a concern because they didn't really report any pain. I can remember one specific instance where I had a child that came to see me, and it was the largest scoliosis I had ever seen. It was well over 100 degrees. It was actually about 130 degrees. It was way beyond the scope of conservative treatment. And the mother was actually really adamant that she wanted me to try and treat her, but it was just too big for me to treat. And I explained that this case really needed surgical interventions at that time. But the mother's concern was, why would she need surgery? She doesn't have any pain. And she was only 13 years old. And I totally understand she didn't have any pain, but the curve was so big, it was really severe. It was to the point where it could start to severely impact cardiac and respiratory function, and that child 100% would develop pain at some point. But even more so, the curve was so big that if she didn't get the right care early on, it could really impact her long-term results and cause potentially permanent problems. So pain is not the number one driver of treatment for adolescents and kids with scoliosis. It's actually the risk of curve progression, and many times they're seeking treatment because they don't like how they look. The reason for this is in growing adolescence, the spine is growing deformed. You see, scoliosis is a three-dimensional spine deformity, and the spine is actually growing and it's elongating, and it's twisting and rotating through growth. Now, in adults, pain is frequently the biggest driver. And actually, pain in people with scoliosis is very common. In fact, people with scoliosis in adults typically have more pain, or it's more common for someone with scoliosis to have back pain compared to someone that doesn't. But in adults, scoliosis is a degenerative problem. You see, when you're an adult and you're done growing, as gravity compresses down, that causes the spine to break down, decay. When we think about adults, generally we either have someone that had scoliosis when they were younger that they still have as an adult and it starts to break down and decay, or some adults actually develop scoliosis in adulthood, which is called a degenerative de novo scoliosis. Now, when we think about degenerative scoliosis in adults, it's important to understand how a curve continues to break down and decay and how this is related to degeneration. So, for example, you get asymmetrical wear on an adult. Typically, what happens in an adult that develops scoliosis later on in life is you start to get a wedge deformity in the disc, where part of the disc is thin, the other part is wide, and then you'll get degeneration on one of the facet joints. So you get asymmetrical wear. As you get this asymmetrical wear, then you also get asymmetrical misalignment. The spine starts to twist and rotate. And then as you get asymmetrical misalignment, you get asymmetrical pressure or loading on the spine. And with that asymmetrical pressure, you get more and more asymmetrical wear, and this progresses round and round. Similarly, if you have someone that had a scoliosis when they were younger, and they still have that obviously as an adult, you start off with asymmetrical alignment, so you have asymmetrical pressure on the joints of the spine, which causes asymmetrical wear, and that cyclically also causes the progression of scoliosis. That also causes more and more progression of the scoliosis. Now, if you're an adult or you're watching this and you have chronic pain and scoliosis, I'm going to encourage you to click on the link below and download our free ebook called Scoliosis Knows No Age Limit. And that's going to give you a lot more information about scoliosis in adults. So we know scoliosis is very common in adults. It's actually and it's not very common in adolescents with adults, or generally they don't have very high levels of pain. But are there things we can look at on someone's x-rays or their body that are predictors of how likely they are to have pain or severity of pain? There's in fact several different predictors. One of the biggest predictors or driver in pain or drivers of pain in adults with scoliosis is global misalignments. We call that coronal imbalances or sagittal imbalance. What I mean by that, when we look at the spine from the front, the top of the spine should be lined up with the center of the pelvis. When we look at the spine from the side, the top of the spine should be lined up with the sacrum or the top of the pelvis. Now, if someone has a shift called a coronal imbalance where their body is not in line, let's say their upper spine is shifted over, especially when this gets beyond 4 centimeters, that's a huge predictor of pain, disability, loss of function, and even risk of curve progression. Additionally, if we look at the spine from the side, and if you get what's called an anterior sagittal bounce, meaning your upper spine starts to shift forward compared to the pelvis, that puts excessive stress on the lower spine. And when that gets beyond, when this anterior sagittal bounce gets beyond about 4 centimeters, that's a huge predictor for pain and disability. In fact, a large anterior sagittal bounce is the #1 predictor of chronic pain and disability in aging adults. So the biggest driver or predictor of pain is having these big global imbalances where you have a big shift in the spine from the side when viewed from the front, or when viewed from the side, your spine starts to shift forward. Now, some other predictors of pain and disability are one, like loss of the normal lumbar curve. When we look at the lumbar curve, the lower spine from the side, it should have a nice curve. Now, if you lose that normal lumbar curve or you have a reversal of that lumbar curve called a lumbar kyphosis, that's a big predictor of pain. Also, it's also a predictor of scoliosis progression. There are some theories out there that even say the loss or reversal of the lumbar curve when viewed from the side or the sagittal view, that may be what drives scoliosis that begins in adulthood. Because when you lose that normal curve, your spine's less stable. That may cause rotation of the spine, which ultimately leads to the development of a degenerative scoliosis in adulthood. A fourth predictor of pain is what we call a lateral aesthesis. Now, normally when we look at your spine, all your vertebrae should stack on top of each other and they should be in alignment from the side. And your spine is ultimately held together by connective tissues or ligaments, from the ligaments that run along the vertebrae or the disc. You can develop what's called a lateral or oleolisthesis. Oleolisthesis is when one vertebrae starts to slip off the vertebrae below it. Now, if you get this slippage, this lateral listhesis greater than 6 millimeters, that's a high predictor of pain, but also curve progression because the spine is unstable. So when we have these unstable joints, that's a high predictor of pain. And a fifth predictor of pain is what we call severe oblique end plate angles. What I mean by that, when we look at the vertebrae are all stacked on top of each other. And if we look at a couple, specifically the L3 and L4 vertebrae, if the top or bottom of those vertebrae is really tilted steeply from the horizontal plane, or it's what we call a steep or a big oblique end plate of L3 and L4, that's a really high predictor of both pain, but also risk of curve progression. So we know there's several things we can look at when we're looking at scoliosis in adults that are predictors of pain. What's really interesting and almost a myth about scoliosis is the size of the curve or the severity of the curve in degrees when measured on conv angle. It has nothing really to do with how severe the pain is, meaning just because someone has a bigger curve doesn't mean they're in more pain. A lot of studies actually show the size of the curve has nothing to do with the severity levels of the pain. So some people could have relatively small curves and still have pretty significant pain levels with adult scoliosis. Now, does pain present differently in someone that has scoliosis compared to someone that doesn't? And the research shows absolutely. And I'll give you some examples. One, when you think about an adult that does not have scoliosis, their pain is mostly symmetrical on both sides. A lot of times it's right in the middle. Also, someone without scoliosis typically gets radiating pain down the back of their leg, which is known as sciatica. Because the nerves lower in your spine, specifically L4, L5, and then S1, 2, and 3, those are the nerves that get irritated, which create your sciatic nerve. When we think about adults with scoliosis, they more commonly get asymmetrical pain. In fact, adults with scoliosis in their lumbar spine or thoracolumbar typically get pain on the side of the curve, and the curve is generally its most severe at the peak or the apex of the curve. What's also interesting is adults with scoliosis typically get radicular symptoms in their anterior or lateral thigh. That's because at the peak of the curve, those nerves are typically form the femoral nerves. They're typically nerves at L2 and L3, but the nerves a little bit higher in the spine where the curve peak is, those nerves control your femoral nerve, which controls your anterior and lateral thigh. So the radiating symptoms a lot of times appear differently in scoliosis patients compared to non-scoliosis patients. Now, another common pain symptom in adults with scoliosis is what's called intermittent claudication. What this is increased pain in the legs when someone stands or walks for an extended period of time. And adults with this frequently will try to compensate by leaning forward. This is caused by a stenosis or a narrowing of the spinal canal, and it irritates the nerves in the lower lumbar spine. Now, just in general, a lot of adults with degenerative scoliosis get increased pain in their spine with standing or walking for a prolonged time. Also, a lot of times adults with scoliosis report pain when they're doing their normal activities of daily living. You will hear them say things like they have increased pain when they're standing and they're leaning forward to do things like dishes, or they're standing and reaching. Doing things like that a lot of times increases pain. One of the most common complaints as far as how it impacts someone's quality of life is not being able to stand or walk very far. In fact, a lot of adults with scoliosis, one of their biggest goals a lot of times is to be able to walk for longer periods of time or for greater distances without pain, because not being able to stand and walk can greatly impact or decrease quality of life. Now, if you're watching this and you're dealing with pain, I'm going to encourage you to request a free discovery call so we can talk to you one-on-one about your scoliosis and what non-surgical treatment options you may be a candidate for. So to get one of those free calls, click on the link below and request a free discovery call. So what are some of the most effective treatment options to help deal with pain? When we look at adults with scoliosis, you can do things like chiropractic or general physical therapy or massage. They may help reduce pain short term. But what's been shown to be the most effective to help treat adults with pain is actually custom bracing. Custom bracing is actually indicated for patients with chronic pain from scoliosis because the brace helps stabilize the spine and also helps hold someone up. One of the reasons bracing can be a great benefit for someone in chronic pain is you actually recover, or you get stronger during recovery. But if your body's out of big misalignment or you're leaning to the side, the muscles that hold your spine up, they're constantly having to work. And what a custom brace can do is act like scaffolding that holds your body upright, and it helps resist gravity, so it keeps your body from collapsing, but it also allows your muscles to recover. Another effective treatment is scoliosis-specific exercise. Now, this is completely different than traditional physical therapy because as you get older, you actually start to lose about 3% of your muscle mass and 5% of your muscle strength every year after the age of 60. And what we can do with ScoliBalance, a method of scoliosis-specific exercise, is we can actually teach you how to hold your body in a correct upright position in better alignment, and we can strengthen and stabilize you in that alignment so your body is more able to maintain a proper erect in a line position, and you're also more aware of your body in alignment, so naturally you start to hold yourself in more alignment, because the more misaligned or unbalanced your body is, the harder it is on your joints and the harder your body has to work just to hold yourself up. It's called the cone of economy, meaning the more aligned your body is, the more energy efficient it is. And the more misaligned your body is, the more energy your body has to use just to keep yourself in an upright position. Now, I hope you found this information helpful. And like I said, if you're dealing with chronic scoliosis or pain from scoliosis and you're trying to figure out what to do, click on that link below and request a free discovery call. This is going to give you a chance to talk to me one-on-one about your specific scoliosis. I'll go over the risk of curve progression and, most importantly, what treatments you're a candidate for. And to learn more in depth about the most effective treatments for adults with painful scoliosis, click on our next video and I'll see you there.